Okay, my name is Amy Lee. I am the program director for the Consortium of Eastern Ohio Master Public Health Program, and Janet and I are the co-chairs to this work, the Core Competencies Workgroup. And I just want to welcome all of you to this meeting. And I have the pleasure to get to welcome all of you. Janet, why don't you introduce yourself?
Okay, I'm Janet Place, and I'm Director of Workforce Development at the Arnold School of Public Health at the University of South Carolina.
And Julie, please introduce yourself.
Hi, everybody. My name is Julie Sharp. I'm a Performance Improvement Specialist for the Public Health Foundation.
And Julie's role will be evident a little later on in the agenda. So welcome, Julie. This is actually the first time Janet and I have spoken to you.
Yes, thanks for having me today.
Oh, you're very welcome. Thank you for joining us. Janelle, I was wondering if you could conduct the roll call.
Sure, thank you, Amy. So far we've got Alan Bergen, Bryn Manzella, Dr. Linda Frank, Desi Legros, Carrie Guida, Kirk Koyama, Lene Simon, Susan Moore. And I have Ron Bialik and Kathleen Amos here with me in the room. Do we have anyone else on the call that I haven't named yet? All right, I think that's everyone.
Okay, very good. Now I get to do the housekeeping items. These are the muting instructions. Thank you so much for keeping pretty quiet. I don't know where the siren came from, but if you have the need to be able to mute your phone, you can press 6. And if you had computer speakers, make sure you mute the computer speakers because sometimes they can echo back. Oh my goodness. Yeah, people who have been on conference call meetings, I've actually heard all of these things. Also, don't put us on hold because we can hear the hold music. I've been through a meeting like that, yeah. Also, copies of the agenda, slides, and all the other meeting materials are available for upload if you just look at the upper right-hand side of your screen. And as you heard, if you signed on a little earlier, we are recording this meeting, and that's what the little red dot in the upper right-hand signifies. And so we are being recorded. And also, there is going to be plenty of opportunities to be able to ask questions. So,
we're getting interference.
Yeah, make sure you mute your phone. There you go. And then you can also use the chat function at the bottom of the right-hand side of the screen. Just put your cursor in that field and then press enter, and we'll be able to see your questions as well. So again, make sure you mute your line until it's the opportunity to be able to ask questions. And did anybody join on after I started the housekeeping? I thought I heard a couple beeps. Anybody else? Okay. Let's look at the agenda. So we're doing the welcome, introductions, and overview. Janet is going to talk about the current status of the core competencies, and Kathleen is going to talk about the enhancement of existing tools and resources, and Julie is going to talk about the competencies for performance improvement professionals. And then we're going to talk about next steps. And then just as a reminder as to where our work group is placed, we guide the activities of the Council on Linkages between Academia and Public Health Practice. And just as a reminder, the Council on Linkages is a collaborative of these 22 national organizations, and they're focused on improving public health education and training, practice, and research. The activities of the Council on Linkages are supported, thank you so much, by the Centers for Disease Control and Prevention. And I don't know if Karina's on the line yet, Karina Lifshitz, but I believe Lenice Simon is on the line from CDC. So thank you so much again for supporting our activities. And
hi, this
now,
is Lainey Simon.
oh, hi.
Hello. Hi.
Yes.
Thank you.
Thank you, Lenny.
Thank you.
So now I'm going to turn the agenda over to Janet.
All right. I'm really excited to see a lot of names that I have not seen before. So we've got some new worker bees, and that's really good. You know, just to get to follow up on what Amy said, I mean, just kind of go over what what the core competencies are all about, and to remind everyone that they are very much a dynamic document. They're flexible and reviewed every 2 years to determine if they need to be updated. And the third version was adopted in 2014, but overall, they're a consensus set of foundational skills desirable for a very broad practice of public health. And they reflect the characteristics the staff of public health organizations may want to possess as they protect and promote. I love this. Protect and promote health in the community. I see them as characteristics that staff public health organizations may want to move ahead in their careers. And if they're designed as sort of the starting point for practice, an academic organization is working to understand, assess, and meet training and other workforce development needs. And I said that the third version was in 2014. A little overview on usage. Greater than 50% of state health departments are using the core competencies in some capacity. 26% of local health departments as of 2013. And obviously, we can do better than that, and we keep working at it. But 92% of academic public health programs, it's interesting to find that one that doesn't really use them, and I'm always working on that. Core competencies are used by the CDC, the HRSA training centers, trained affiliates, Healthy People, 2020, Public Health Accreditation Board, and other organizations. They've been assessed over 107,000 times since the release of 2014, so that's really exciting. The resources and tools have been assessed more than 206,000 times during the same time frame. We are growing. And again, these are the kinds of things that people have used them for, and for which we collect examples, and are always looking for new examples to add to our resources. Job descriptions, performance objectives, performance reviews, workforce competency and needs assessments, workforce development plans, those are especially all wrapped up in FAB accreditation, training plans, course review and development, discipline-specific competencies, meaning that the core competencies often serve as the template for discipline-specific competencies, where the same domains are kept, but then specific competencies are added for certain disciplines. That was certainly true of public health nursing, for example. And again, preparing for accreditation. So the FAB standards and measures for domain 8 directly relate to workforce development. So this has really helped jumpstart the use of the competencies among state and local agencies. All right, well now I can turn this over to Kathleen.
Thanks, Janet. I'm going to try to be really close to the phone here. I noticed we had a little note in the chat box about volume, so if you still can't hear me, please do let me know, and I'll do my best to get...
Somebody couldn't hear me? I'm shocked.
I know, shocking, isn't it? Thank you. Well, as Janet mentioned, and Amy mentioned as well, I'm going to talk a little bit about tools and resources and share a little update in terms of where we are in developing tools and resources that support use of the core competencies, as well as what comes next over the next few months to year or so. There we go. So just to start, this is a list of many of the tools that we have already. So
For those of you who've been part of the work group for a while, you know that, as Janet mentioned, the core competencies were revised in 2014, and we've spent the time since then really focusing on resources and tools and examples and those sorts of things that will help people actually implement or incorporate the core competencies into their workforce development activities. So over the last couple of years, we've developed a number of tools, and this is a brief list of some of the major ones that we have available currently. So I'll just run through these quick to give people a little background if anyone is unfamiliar with any of these. So we do have a set of crosswalks, the first one of which maps the 2014 and the 2010 versions of the core competencies to really show the relationships between the individual competencies in the two versions. And this is a tool that we created really quickly after the release of the 2014 version of the core competencies and was meant to help people sort of make the jump or make the transition from one competency set to another. We also have a second crosswalk which looks at the relationships between the 2014 version of the core competencies, so the current version of the core competencies, and the essential public health services. So what this crosswalk does is help illustrate how the skills represented in the core competencies relate to the delivery of the essential services. We have a set of competency self-assessments, so 3 self-assessments, one for each tier within the core competencies, which can help in assessing gaps in knowledge and skill related to the core competencies, and in determining where you might want to focus your workforce development or your training efforts. So those are all available on our website. Those are PDF documents that will do some automatic scoring for you, and we know that a lot of people are using sort of that format that's been laid out there and then taking it and moving it into survey software in order to aggregate large pools of data. And just as a quick reminder, if anyone doesn't have a mute button on your phone, if you want to mute your line, it's just *6, and the same works to unmute the line when you want to ask questions and those sorts of things. So the competency self-assessments are really popular, perhaps the most popular tool that we provide related to the core competencies, and actually were created originally by Janet. So that's really nice. And then we have, in a similar vein, we have a 3-step competency prioritization sequence. And so this tool is actually a set of 3 quality improvement tools, a radar chart, prioritization matrix, and a matrix diagram that are used in sequence to assist in selecting core competencies domains for workforce development that address the gaps that maybe currently exist in terms of skill level within an organization, while also being sure that you're focusing on skills that will actually, or that align and actually help build, achieve the organization's strategic goals. So you want to both be focusing on where skill building is needed, but also where skill building is most relevant or most useful to you as an organization. We'll talk in a minute about a couple of specific collections of examples of how the core competencies are being used, but we also do have sort of a general examples of core competencies use collection. So we've, over the last any number of years, have been keeping our eyes and ears open for cool examples of how organizations or individuals are using the core competencies in a variety of areas. And so we do have a web page on our website that houses this information. This is sort of a constant, ongoing work in progress, and we actually, I believe, we have many more examples that are currently on our website, and it's just a matter of figuring out, and it's one of the things that we'll talk about in a few minutes, but figuring out how we can best share content and get it out to the public health community. So currently we have examples related to activities like, I think Janet mentioned, development of discipline-specific competency sets, conducting assessments, providing professional development, those sorts of things. We also, in addition to the examples of use, we have developed over the last year or so a set of frequently asked questions. So one of the things that we do here at the Public Health Foundation in our role as staff to the Council on Linkages is provide technical assistance related to use of the core competencies. And so we answer a large number of questions and inquiries related to the core competencies. So we compiled some of the most popular ones that we received and made the answers to those available online. So that FAQs document contains questions in a variety of areas, such as the development and revision of the core competencies, use of the core competencies, public health education, accreditation, other competency sets, resources and tools, and information about how you find more information about the core competencies or can get involved in activities like this. And finally, last on the list here of my sort of quick overview of where we stand in terms of what we're focusing on are two collections of job descriptions and workforce development plans. So these are two tools that we are currently working on, really actively working on this year. And one of the things that we really frequently hear is from people working in public health is that it's really helpful to see examples of what other people have done as people are working on a variety of things, but in our case it tends to be related to the core competencies. So we get a lot of requests for examples of workforce development plans or examples of job descriptions that people can use and look at when they're creating their own workforce development plans or job descriptions. Something to, kind of get you started as you're thinking about putting these sorts of documents together. So these are really popular requests for us. I do, as Janet mentioned towards the beginning, the influence of the Public Health Accreditation Board and accreditation for health departments. They do really believe this is a huge driver of interest in this area. So if anyone is not intimately familiar with the standards for health department accreditation within Domain 8, which focuses on workforce, there are requirements for health departments to provide job descriptions that include the competencies, both generalist competencies, which would be sort of where the core competencies fits in, as well as specialty competencies related to a particular job, so that they can ensure that they're hiring and training, et cetera, people with the skills needed to perform the functions that they're being asked to perform. There also is a requirement that health departments provide a workforce development plan, which includes an assessment of staff competencies and then plans for addressing any gaps that are identified. So I think accreditation has played a huge role in driving interest in these types of activities, or these types of resources. And I think we're seeing an increase in questions and requests because of that. So in order to help health departments and other organizations that are working in these areas, over the last few years, the Core Competencies Workgroup has been working to collect examples of both of these types of resources and make them available on our website. So we are looking to continue to expand these collections in terms of, and I should mention that the types of job descriptions and workforce development plans that we collect are specific in that they all incorporate the core competencies in some way. So those are the ones that we are particularly interested in. So we do have collections of both of these resources on our website currently. Job descriptions that incorporate the core competencies, we currently have about 25 or so of those, and they are available for a wide variety of positions ranging from like clerks and project assistants all the way up to program directors and health commissioners, as you can see in the example actually that we have on the slide. So we have about 25 of those so far, and close to 20 of those, I believe, were developed by health departments that are accredited. Similarly, with workforce development plans, we have a collection right now of about 25 workforce development plans from a variety of types of health departments in different states across the country. And about 15 or 20 of those come from health departments that have been accredited. Excuse me. So what we're really looking to do over the next few months is to be able to, continue to grow these collections. In order to do that, we really need your help. So we hear all the time how much appreciation people have for being able to look at these examples as their, as starting points as they're creating their own resources. And we really can't overemphasize the value that you all, in sharing these types of documents, are providing to the public health community, and being willing to sort of, put your work out there and let other people see it. I think it's a really important way that we help to build and strengthen the workforce as a whole, and we really do hear people being very appreciative of it. So with that, I guess I'll pause for a minute. I know we mentioned there's lots of time for questions and discussion, and this is a perfect time for some of that. But I'm just interested to hear if anyone has any thoughts or reactions. We'd love it if you all have examples of job descriptions or of workforce development plans that you're able to share, or maybe you have ideas of who we might reach out to or who you might reach out to get some of these examples. So I guess I'll just open it up. If anyone has questions, suggestions, comments, anything, feel free. Again, it's just *6 to unmute your line. Feel free to talk as well as to type in the chat box if that's easier for you. Oh, sorry.
Go ahead. Well, this is Ron at PHF. Many of the resources, the examples, job descriptions, et cetera, they come from the practice community. And if any of you on the call have any of these that you're willing to share, or if you're aware of others who do, please let us know, because we're happy to contact others, or we would love it if you could contact others. But for this to continue to be useful to the practice community, having the examples from you and your colleagues are really essential. So any thoughts that you have, anybody's working on workforce development plans, identifying competency gaps, developing training plans, job descriptions, anything like that is really game, if you will.
Hey, Ron, this is Amy. I'm not public health practice. I'm public health academia, but I have what we call the Office of Public Health Practice, and the members are public health practitioners. And I know, they're all involved in accreditation efforts. And I think at our next meeting, I'll probably just ask them to see if they're using the competencies as they're putting together their, job descriptions and anything else with workforce development. Actually, that's a really good idea. I think I'll do that.
That's great, Amy. And we have really good working relationships with the Public Health Accreditation Board, and they've been great at providing us with data. But because of the agreement of confidentiality, they can't provide us with the workforce development plans. They can't provide us with the job descriptions, et cetera. Those have to come directly from the agencies who produce them. I also think it's good for people to see works in progress, to the extent I can't speak today, that people are willing to share those.
Does anyone have, so I guess if we back up from specifically job descriptions and workforce development plans, have you, are you doing any other work within your institutions related to the core competencies, or know of examples of how people are using it just generally? I know we've seen examples of needs assessments or different groups working on developing additional tiers related to the core competencies to pull out or target specific groups of people, or modifying the examples of how the language in the core competencies has been modified to appeal to certain groups of people. Is anyone aware of any cool projects like that that we might be able to learn more about or follow up on?
Kathleen, hi, this is Bryn Manzella. I don't know how cool this is, but here in Jefferson County, Alabama, in our health department, we have actually created a quality improvement initiative around the core competencies themselves, and we have sort of vetted this as sort of a training type thing. So we used the core competency assessment, the 2014 version last summer, to identify or get our staff to help us identify where they had some deficiencies. There's some interesting findings from that, and then we are now using that within a team format to develop an additional training plan, and then we'll evaluate the impact of the training plan using the tool again.
Definitely cool.
Julie might not think so.
This is Alan Bergen from the Pima County Health Department. 2 years ago, when we started this process, we worked with the Western Regional Public Health Training Center to adapt the core competencies to separate out kind of clerical support staff from public health professionals. And we actually presented at NACHO 2 years ago on this project, and my understanding is, working with the training center, is that they now offer that assessment as one of the options of doing the assessment to meet accreditation. We're in the process of redoing the assessment. We do it every 2 years. And when we reach back out to them, they still use that assessment and have said that most of the health departments they work with choose that assessment over the other one, the original one that they've developed.
Interesting.
Yeah. And you said that was the Northwest?
No, the Western Regional, out of the University of Arizona.
Right.
I think Doug Tarrin is.
Yeah.
Yep. We work closely with Doug, so that's great. Thank
Yeah,
you.
I know when we were developing this, Doug had a lot of conversations with you all about splitting those two up, but I don't think it ever happened.
Right. Yeah, we actually had a discussion here yesterday about Doug and the center's work in pulling out courses from Train that are related to the competencies and the competency gaps identified in those surveys. That's something else we've thought about reconnecting with him about. Sounds like there are a couple of things we should reconnect with him about.
Yeah, I mean, I've talked with a number of my colleagues in other county health departments in Arizona, and my understanding is they've used that assessment that we've developed, and I mean, unless anybody disagrees or has any objections to it, I think that's the standard one they now use when they implement it. So that kind of leads me into my second thing about on your website and talking about tools and resources, it really doesn't list any connections with the public health training centers, because I can't tell you how useful working with the public health training center it was to actually implement that survey. I mean, they have it all electronic. They provide a report for us. They provide trainings for us, because they're all linked to Train as well. And so I think that's a really valuable resource for at least health departments and other people wanting to use the core competencies to be familiar with, because there's no cost to working with the training centers.
And this is Janet, and the training centers in their current form and their previous form were instrumental in moving along with the Public Health Foundation, but really promoting the core competencies. So I guess it's kind of like we get used to it, sort of it's a given that that's a major part of it. But in terms of the training centers advertising what they're doing, there's not a really easy way at the moment to find that, but it is a good point you're making that we really need to make sure that that continues, that relationship continues.
Yeah, it also sounds like a follow-up discussion. Like National Network of Public Health Institutes is a member of the Council on Linkages, so that might be a good follow-up discussion as well. Thank you.
This is Amy again. Ron, I know when I saw you at APHA, you had said that you had looked at the new Council on Education for Public Health, the new accreditation competencies, and thought that our competencies were used heavily there. And also, I know, too, in earlier iterations of their accreditation criterion, they had done away with the word competencies, and after a discussion with them by you and some others, they retained that language of competencies. So thank you for making it less confusing for all of us.
Usually I try to make things more confusing, so thank you.
Does anyone have any other thoughts or ideas or suggestions of, like we said, places we might look for more examples? Or I appreciate the mention of the public health training centers. That's a discussion we had with some folks at APHA as well. So I think that fits really well with what we've been hearing. Are there other thoughts or ideas, suggestions for either collecting additional examples is one focus, but obviously at the same time we really want to make sure that these examples and these resources are getting out, that we're communicating, that we're disseminating, we're making people, if no one knows about them, they can't possibly use them. So if you have suggestions for those types of things too, we'd be happy to hear it. Okay. Well, this isn't your only chance. I will emphasize that. So as we've been talking about all along, we are going to be continuing to develop tools going forward, and this really, I do think is really important to making the core competencies actually usable in the field, giving people examples, those sorts of things. We will be following up after this meeting. Janelle and Amy mentioned at the beginning that this meeting is being recorded, so we will be following up and do a cost of the recording as well as notes from the meeting. And we'll be sure to include information. If you think of examples or ideas, if you have suggestions for us following the meeting, you can send them our way at any time. And so we have contact information in the slides, and we'll make sure that goes out in the follow-up email as well. And as we continue to dream up new tools and start working on new things, we'll obviously be coming back to you all for your guidance and assistance with those. So we really appreciate your engagement in the process. And with that, I am going to turn it over to Julie to talk a little bit about a new project that is starting here, Competencies for Performance Improvement Professionals.
Okay. Thanks, Kathleen. Can you all hear me okay?
Yep. Mm-hmm.
Yes. Great. Hi, everyone. As I mentioned at the beginning, my name is Julie Sharp. I'm a Performance Improvement Specialist with PHF. We are currently working in cooperation with CDC through a process to develop a set of competencies for another specific discipline, and that is public health performance improvement professionals. This group has been defined as public health professionals who work in some capacity to develop or implement plans and related activities in the areas of quality improvement, performance management, accreditation readiness, and or community health assessment and improvement planning. As Kathleen mentioned earlier with regard to Domain 8, we've seen a lot of interest. Similarly, with regard to Domain 9, which is focused on the areas of performance management and quality improvement. And we've really seen the field of performance improvement in public health only grow as health departments are pursuing accreditation and as organizations realize that implementation of quality improvement performance management are really going to be beneficial to them operationally. So it's the hope that in developing a set of competencies for this specific discipline, it's not only going to inform the field of what skills, competencies, knowledge is desirable, but also will inform and drive training and education to build those skills, and also in the development of documents such as job descriptions and in creating performance objectives. In 2015, PHS used the existing performance improvement managers competencies and expanded upon performance improvement focused competencies in the core competencies to develop a draft set of 14 performance improvement competencies. We also used feedback from providers of technical assistance and training in the field who've worked with health departments, as well as input from partner organizations such as AFTA and HO, NNPHI, FAB, and our partners at CDC. We have attached the list of the current 14 draft competencies as a download for you under Files in the top right. In 2015, they were vetted with a couple of groups, namely the Public Health Performance Improvement Network, or PHPIN, and were used and vetted as a component of the 2016 Public Health Improvement Training, or FIT. In addition to the development of the competencies last year, PHF created web pages that not only talk about each of the competencies in detail, but provide a list of resources for each of the 14 competencies. We did this because we wanted to provide guidance to the end user on how they might be able to work toward development of the competencies. These lists provide connection to existing tools, toolkits, templates, and other resource materials, and you can go to phf.org/PI competencies resources to check that out. This is what the landing page looks like currently for the draft competencies. You'll find a little bit of the background information I just shared with you. You can download the PDF of the draft competencies from the website and then be able to access each of the 14 via hyperlink. When you access any of the 14 competencies, you're going to see the competency itself and then hyperlinks and descriptions of the related resources. Giving you a little bit of background in that as we move into this year, with that groundwork done, PHS is working with CDC to conduct a robust environmental scan. The hope is that this would then be used to develop a more refined and vetted set of performance improvement competencies. It's also going to help us identify the needs of performance improvement professionals. So what are they looking for? What are they working on? What are they thinking about? And then so that we can support their use and attainment of these performance improvement competencies. The literature, or the environmental scan is going to include reviews of literature and reviews of web-based resources, interviews with key informants, some queries of the public health community and practitioners in the field of performance improvement, as well as an evaluation of our past work in this area. Because the Council on Linkages, and more specifically this work group, has been providing technical assistance, feedback, support to organizations in developing discipline-specific competencies that build off of the core, we are currently developing what we have coined the Performance Improvement Subgroup of the core competencies for public health professionals work group. So a subgroup of the group that's on this call today. This subgroup is going to provide guidance on the work related to the development of performance improvement competencies. Specifically during this project year, the subgroup will work to support the completion of the environmental scan, So doing activities such as participating in discussions about the environmental scan, helping to identify key documents and resources that we should include in our review, supporting the development of the environmental scan report by reviewing and providing comments on the draft and final reports that we'll be submitting. The subgroup is designed to be composed of public health professionals, primarily from health departments and academia, not necessarily limited to that, but who have experience in development of competencies, serve enrolled as performance improvement professionals, have an interest in this work, or all of the above. We at PHF will be convening and facilitating this subgroup in this project year. We're hopeful that the results of this environmental scan and the historical work that has taken place will serve as a starting point for developing that more refined and vetted set of PI competencies in the next year. So I'm here asking for your help. We are currently looking for volunteers to join the subgroup, looking for individuals who are willing to provide support, feedback, and guidance through the process of the environmental scan. Between now and the end of the project year, which is June the 30th, we would be looking for your feedback on the process, including suggestion of materials and resources to include in the environmental scan, suggestions of other potential members to include as a part of this group, and then obviously the feedback on the environmental scan and as it's drafted and finalized. We expect to have 2 calls during the year, potentially piggybacking on some existing calls so as not to tie up you all with different days and meetings. And we anticipate potentially doing a conversation via email or maybe some small group phone conversations, just to get that feedback and that discussion. My contact information is going to be at the end of the presentation today, but I will stop there and see if I can clarify, answer questions, provide additional information. Oh, Kirk, great. Thank you. Thank you. I'll reach out. Okay. Well, I will look for more communication to be coming about this project. Thanks so much. And Amy, I will turn it back over to you.
Thank you so much, Julie. You know, I think to kind of sum up the meeting, I'm learning that the Council on Linkages is really becoming the go-to, or Public Health Foundation is really becoming the go-to place to look for competencies. And when I learned that you were working on the performance improvement competencies, I've actually been approached by other health departments, you know, asking about this and, you know, who could speak about performance improvement and, you know, who could help them with performance improvement. This, I think, is really very timely. But I think we've also learned that the core competencies really are being used very widely in both job descriptions and workforce development efforts. And Kathleen and Janelle have some interesting stories from even international places and people asking about the competencies. So I've really been impressed. And also Janet, of course, has worked so hard on promoting the core competencies, as you all have been as well. So we really appreciate your help in trying to both promote the core competencies and also to try to gather any other examples of the core competencies or you know, suggest any other of the core competency related resources or tools that they might be able to share, that people can share with us, and make sure that you contact Janelle. Janelle, of course, her contact information is on this last slide. And, of course, anybody who is interested in joining the Performance Improvement Competency subgroup to contact Julie Sharp, and her contact information is on this last slide. And, of course, to remind you all that the monthly newsletter and all of the updates are regularly being provided, and often they update all of us on the core competencies. So if you aren't getting these contacts and these newsletters through your email, please contact Janelle as well. And also, I just want to acknowledge again from the CDC, I see Karina is here as well. Karina, I didn't know if you wanted to say hi to the group or just let everybody know.
Absolutely. Hi. Good afternoon, everyone. This is Karina, and I had to join a few minutes late, but I got to hear most of the conversation, and I hope you are all as excited as I am about the work being described today.
Yes, we are. It's really amazing, I think, to hear at how many people are using them and how many organizations find them of great value and are asking for tools or are sharing tools. And so we're really excited to be able to update the entire work group on the progress that's being done on these core competencies. So thank you for being a part of this as well.
Thank you. And I don't know, I imagine you may have done introductions at the beginning, the portion I might have missed, but if you didn't, I wanted to make sure to introduce Leanie Simon, who is also a technical monitor working with Public Health Foundation on this work, specifically with the performance improvement competencies and some of the tools described.
Yes, thank you so much. Yes, we did do some introductions. Thank you. We are going to follow up with all of the work group members, hopefully in the near future, to share a meeting summary that is going to include the recording of this meeting. It's still recording. There's the red dot in the corner. And all the information for sharing the job descriptions and the workforce development plans and joining the performance improvement competency subgroup so that you can contact Julie or Janelle. And although we haven't scheduled the next work group meeting, we're really looking at one possibly early next year. So make sure you keep an eye on your emails for this. The meeting is likely going to provide an opportunity to share updates on the progress of the tool development and also with the performance improvement competency subgroup, among other topics. And of course, we will address any other items that will have arisen during the meeting. So please, does anybody else have any follow-up items, any final questions or comments before we end this meeting?
Amy, this is Ron. I see that there's a question in the chat box, if I may address that.
Please, yes.
Then the question is, will the PI competencies be incorporated as a domain in the core competencies? So a couple of comments about that. One is that the core competencies themselves do have performance improvement, quality improvement, performance management integrated across domains, so it does appear in a variety of different places. The idea here with the performance improvement competencies is that it's really a specialty or a focus area that's emerging in the public health community now within agencies and organizations, and that individuals who are in those roles are seeking some guidance about the skills and competencies they may need, and those who are providing continuing education and initial education out of academic institutions are seeking some guidance on what to teach. And so these performance improvement competencies can help provide that guidance as a separate set of discipline-specific competencies. So that's the thinking at this juncture. In addition, I should mention that a request that we've had really the last two times that we made revisions to the core competencies for public health professionals has been that we not change the domains. And that has come from both the practice and the academic communities, and that a lot of organizations use those 8 domains as a way to structure needs assessments, training plans, and a variety of activities that they already have. And so we've been respectful of not wanting to make those changes. So but the primary reason really for our thinking about not adding this as a domain is that we are looking at it as more as of a discipline specific. So we have the Quad Council discipline specific competencies for public health nurses. We have epidemiology, we have informatics, there's public health laboratorians, and there are several others as disciplines. We're looking at this emerging discipline in public health as performance improvement professionals. So I hope that helps.
Looks like Alan's typing. Maybe a follow-up question.
He's going to say, I totally confused him. Sorry, Alan.
That's what you do. Perfect.
Thank you.
Oh, okay, good.
Okay. I won't be fired today.
You have not been successful at confusing things further.
Thank you.
Amy, this is Kathleen, and I have one more thing
Sure.
that I might throw out there. Just in terms of, I think in the discussion of the public health training centers, there was a mention of the Train Learning Network, and so I know that we have a lot of public health training center members in our work group, and that the public health training centers are large users of the Train Learning Network, as well as a variety of other users. But we have been working here at the Public Health Foundation, and Ron, you can speak more about this if you want, but over the last few years to rebuild the Train platform. So the launch of the new National Train platform will be early next year. And so we've just scheduled a webinar that will introduce the new platform. So I just wanted to share that if anyone's interested. The webinar will be, and we'll include this information in the follow-up email as well, but the webinar will be on Thursday, January 26th at 2 p.m. Eastern Time. There is registration currently available through Train if you're interested. And like I said, we'll send the information out to make that a little bit easier. But, you know, we've done a lot of work with Train. The core competencies are built into Train, so that allows learners to you know, focus on competency-based training. And that's obviously a really large connection to the public health training centers as well. So we just kind of wanted to give you a little bit of advance notice about the webinar that's coming up. If anyone's interested in attending that and learning more about what Train, the new Train platform will look like and how it will function. Ron, if there's anything you want to add to that.
Nope.
Nope. Okay. Nope. So we'll be sure to include the details of exactly how you can get registered for that webinar if you're interested as well in our follow-up email.
That's a great idea. Anybody else with any comments, announcements of webinars? Janet, did you have any other follow-up? Or?
No, just soaking it in.
Well, I again want to thank everybody for supporting, advocating, and promoting these core competencies and all of your input and feedback for these competencies. So if everybody has had their say and given their feedback and comments, we'll just say thank you so much and have a great holiday, and we'll see you next year.
Thank you.
Thanks.